Hello, everyone, and welcome to our lecture on health insurance basics in our healthcare settings, claim cycle, and claims processing class. I'm Ms. Blair, and I'm going to take you through our lecture today. So, what can we expect to learn today? We're going to be able to summarize the basics of health care insurance plans. We're going to summarize the purposes of medical documentation, very important in medical billing and coding. We're going to summarize the career roles of billing and coding specialists, including the aspects of an office visit and the financial activities associated with patients. And we want to talk about the professional skill sets, education requirements, and employment opportunities for insurance billing specialists. That's why you're here. You're here to increase your skill set, to get your education concerning billing and coding. So, what is a health insurance specialist and where is the career going? A career is a field, it's a pursuit of a progressive achievement, especially in public, professional, or business life. So, if you're here, you're working on your education, you're not in you don't want to just have a job. You are working on a career. So once you have your diploma or once you get your degree, you are in the healthcare field. There are many paths that you can take. You don't have to just be a coder. You don't have to just be a biller. How about going into compliance? Meaning, is the facility following the rules and regulations that they should? How about going into auditing? Are they doing correct things? Um, there's so many different opportunities. And then when you go through these career paths, there's the opportunity for advancement because a lot of just jobs is not an opportunity. And so because you spent the time getting the education, you want to be able to advance. Now, there is a demand for professionals. So what is a professional? And let's see if you are the fit the definition of that personal or a professional, I'm sorry, is a person who has a type of job that needs a high level of education and training. Well, I think you all fit that because you are here. You are learning about billing and coding, or you're learning about accounting, or you're learning about mobs. Okay, so you all fit that definition. So from now on, let's work as if we are healthcare professionals. Let's think as a healthcare professional. Okay, that is what you are training and going to school to get your education for. So, what are you going to do? You're going to try to understand claims processing and the billing regulations, possess accurate coding skills, successfully appeal underpaid or denied insurance claims, and demonstrate workplace professionalism. Now, our business partners are very, very serious about professionalism. Okay? They expect that once you graduate, that you will show your professionalism and that you will be very skilled in that area as far as working as a team, understanding some of the business world, that your attitude will be on the positive side, that once you walk into the office every day, that you leave your personal issues at the door. So that's what we need to start working on right now. Okay. So what else are we going to talk about? How about career opportunities? And this is what I was just saying. Health reimbursement specialists. What do? They try to go and find out why our claim wasn't paid. Let's go find the money, the reimbursement. A claims examiner, same thing. It's in the billing. Um, The claim wasn't paid. It was denied, or it was paid but not paid at the level that we thought it would be. What happened? A medical administrative assistant, for those of you that are in MAA mobs. Well, you work in the office. You could be at the front desk. You could be registering patients. You could be in the back. You could be ordering, or you could be working on referrals or prior authorization requests. How about medical coding? Well, here you are. CPT, you learn about ICD-10, CM, and remember, right now you're not going to learn to code. You're in a program, and what that means is over the course of the program, you will learn what you need. Right now, you're at the beginning of the program. You are in a class, and as you move forward, you will go into different classes that you need. And then you will get to your coding class. So this is a program. It is not now you learn to code and then you're done. Okay, so let's remember that. Health information technicians, what do? They manage the data and they review it for quality and accuracy and security. So they may look at all of the coding services and say, okay, well, why do we always get denied for this particular service? Maybe the coders don't know how to code it. Maybe there's something wrong. So all of these uh, career specialists are important for a facility. So let's talk about the basics of insurance. What is insurance? It's a contract between whoever wants to get the insurance and the insurance company. And that contract says that the insurance company will protect the person from loss, a loss of property, or a problem with their health, which would be health insurance. And then the insurance company agrees to guarantee payment to the insured person for an event that was unforeseen, such as a theft. The car got stolen. You walk out the door and where's my car? It's gone. So first thing you do is you call the police, and the next thing you do is you call the insurance company. And then for injury, well, you go to the hospital, and then the hospital is going to bill the insurance company. Okay, very important. A premium. It's a dollar amount that's in the contract that's signed with the insurance company as for coverage. It's normally on a monthly basis. You have to pay that premium every month so that you can keep your insurance. Sometimes it's maybe, I don't know, it depends on whether it's an insurance individual or a family. If it's an individual, maybe it's $50 a month. If it's a family, it could be $150 a month. And it's the same with other types of insurance. If you have automobile insurance, you may pay $75 a month. Disability, liability, malpractice is what healthcare professionals, clinicians have in case they're sued. That way, they don't have to go into their personal monies. Property and life insurance. We all should know about life insurance. Okay, so let's look at some key terms about life insurance. I'm sorry, about insurance. Okay, so group health insurance. So that's when you get insurance through your employer or other organizations such as union. It's normally cost per person. That's because you have an enormous amount of people. So the more people you have, the less it's going to cost. And the employer or the other organizations, such as the union, they can bargain with the insurance company. See, they have that bargaining power. And then you get more coverage in those group insurance plans. Okay. Now, then you can have individual health insurance. And that's where a person will go out and they will try to find their own insurance policy. It's probably going to be a higher amount, the premium will be, and it's going to be based on their age, their gender, and their pre-existing medical conditions. Now let's talk about that because you may hear that on the news or when you are trying to find a insurance plan, even if you have group health insurance. A pre-existing medical condition is just something that you have. And most people have a pre-existing medical condition. It doesn't mean that it's something that's very harmful to you. You could have asthma. It's pre-existing. You had it. You could have gone to the hospital and then you had a C-section. It's pre-existing. You had it before. So be careful about pre-existing. Most of us have a pre-existing medical condition. Public health insurance is usually through federal or state government, Medicare, Medicaid, two different things. CHIP, which is Children's Health Insurance Programs, and TRICARE is for our wonderful military personnel. Then we have single payer plans. That is a healthcare system that's funded by taxes, um, and it is centralized, okay, through the government. And then we have socialized medicine, and the government owns, they operate all the healthcare facilities, and the providers get a salary from the government. And that way, everyone is covered. Everybody has coverage and can get health care. And then universal health insurance is everyone has access to health coverage, okay? Well, listen to it very carefully. Everyone has access to health coverage. Access and having health insurance is two different things, okay? And as a future health care professional, words and details are very, very important. Okay, healthcare documentation. One thing you should remember, if it's not documented, it didn't happen, period. A patient record or a medical record is a document where notes and results of all healthcare services provided to a patient are kept. And probably most of you have gone to a doctor or an emergency room and have seen your record where whomever the professional is writing in your record, or now they have a tablet or they have a computer and they are taking notes, and that's your medical record. Everything they do must be written or typed into that record. And why is that? Main reason is continuity of care, so that others who are treating you have access to the information, and it will assist them with any additional care or treatment that you need. So if you go to your PCP, meaning your primary care physician, and then you need to go back in 2 weeks and you go, but he's on or she is on vacation and you see their partner. If they didn't have your medical record, they would not know anything about you. They wouldn't know about your diagnoses or any of your pre-existing conditions, what happened 2 weeks ago when you were there, if you had any allergies, what surgeries you had. They would know nothing about you, and it would not help them give you the proper care that you needed. So the number one reason is continuity of care. And if that doctor did not put anything in your chart on the day that you came to see them, it didn't happen. It sounds a little crazy, but that's the way it works in healthcare. Okay, everything must be documented. that a clinician does. Doesn't mean you have to document what you do as a biller or a coder or whatever. Now, auditors, yeah, you have to document. Um, but just remember that. Okay, there's also other purposes for having a medical record. We want to evaluate the quality of patient care, and that could be part of an audit where people come in and they review the record and they see, if the patient is receiving the quality of care that they should be. Um, is a person with diabetes being treated properly? Are they getting the right amount of insulin, for example? That would be another physician that would have to do that. Providing data for use in the clinical research. I've been in clinical research before. They will take your name and everything identifier. They won't use that. They have to provide information to third-party payers for reimbursement. So that means that if the insurance company, which we are now going to say third-party payers, because remember we are health care professionals, want additional information in order to pay the claim, which is the bill, then you will have to go into the record to get that information. If there's no record, then the claim can't be paid. And medical record is a legal record. It's a legal document, and it can be asked for in a court case. So there's something that's called medical necessity, which means that every service or procedure or supply that's given to a patient, it must be necessary and appropriate for whatever disease or evaluation or treatment or injury that the patient has. So every service, every time, you can't just go and say, I just feel like I need to go to the doctor today. And you go to the doctor and there's no reason for you to be there. And the doctor examines you and he knows you shouldn't be there. Instead of just saying, well, Mrs. Smith, you know, I think, just come back at a later date and then not really seeing you. The care there must be a reason. The reason is what we're going to call diagnoses, and we'll talk about that later. Okay, and it must be a reasonable care. It can't be some kind of witch doctor stuff. It has to be what most other physicians in that position would do. Now, there's something called elective procedures, and most people think that they are not medically necessary. Well, let's talk about elective versus an emergency. Most procedures or surgeries are elective. That means it's not an emergency. The patient and the doctor agree to a time and a day to have the surgery or the procedure. It's not life-threatening to wait to have the procedure. For example, you go to the doctor and they say, I want you to have an x-ray or I want you to have a CAT scan. We're going to schedule it for next week. That is elective. It's not life-threatening. You have made a decision for a later date, but it's still medically necessary to find out what's wrong with you. An emergency means that person needs treatment right now, because it could be life-threatening if they don't get the treatment. So, doesn't matter, because remember, every service must be medically necessary. So, what are the requirements? Just like I was saying, it needs to be for the diagnosis and treatment of the condition that the patient has. Okay. It has to be consistent with the standards of good medical practice in that area. So it has to be what most other physicians or professionals particular in that particular area would do. And it's not just because the physician wants it or the patient wants it or the healthcare facility wants it. Like, hey, doctor, I think you should just give me a CAT scan. And he says, sure, why not? I'll just order one for you. No, it, it doesn't work that way. Okay. So let's take a look at some examples of medical necessity. Now, a provider did a right knee X-ray. Okay, and for whatever reason, on the claim, the the diagnosis said that the patient had shoulder pain. Remember, we said the service and what was wrong, what the patient had to match. Well, knee and shoulder don't match, so claim wouldn't be paid. Okay, so in example 2, the claim had a service for a chest x-ray, and it had a diagnosis saying that the patient had severe shortness of breath. Okay, well, if you have shortness of breath, that means that there's probably something wrong with your lungs. So they're going to take an x-ray of your chest because that's where your lungs are, right? They're in your chest. So those two things match. I need to have an x-ray of the chest if I'm the physician so I can figure out why they have shortness of breath. Is their lungs filled with fluid? It's something like that. So they're going to receive the reimbursement for medical necessity for that claim. So it's time for us to wrap it up, okay? This lecture will be available for you to come back and review it. We were in chapter 1 for this lecture. Please always remember to read or listen. If you go to Cengage, listen to our textbook before submitting your assignments, your assessments, and your discussion posts. Okay, discussions are supposed to be about what we have read. And also, for your discussion replies, just saying, I agree, or that's a good post is not sufficient. Discussions are to discuss. And you do not have to agree with your classmate. And don't agree with someone who gives out wrong information. Now, help is always available. You can go to an instructor's office hours. You can contact academic services. They have one-on-one help. Their office hours are listed. You can also find their hours in Blackboard. If you're having computer problems, the first thing to remember, your instructor cannot help you with it. Instead of calling or emailing your instructor, please call tech support. The number is highlighted in yellow. Some things that may happen, for example, if you can't submit an assignment or you need help with Microsoft Office, please contact tech support and they can help you. Okay? So I want to thank you for your attention, and I will see you at the next lecture. And until then, take care. Bye bye.